Well, welcome everyone. Thank you so much for joining us today for White House Perspectives, the Ethics of AI in Healthcare. It is my absolute honor to introduce our distinguished speaker for the afternoon, Miss Camille Stewart Gloster, a true trailblazer at the intersection of artificial intelligence and ethics. Miss Camille Stewart Gloster is a globally recognized powerhouse in cybersecurity and technology strategy with a distinguished career as a White House Deputy National Cyber Director and Google's Global Head of Product Security Strategy. Named among Business Insider's AI Top 100 People in AI and 2024 Changemaker Award honoree, Dr. Gloster has crafted landmark policies, including the 2023 National Cybersecurity Strategy and the groundbreaking Executive Order on Trustworthy AI. Her visionary leadership drives innovation, shapes United States security, and positions her at the forefront of AI ethics through the evolving digital health landscape. Please join me in welcoming Ms. Camille Stewart Gloster.
Sounds great. Thank you all for having me. This forum to explore the intersection of AI and medicine is extremely important, and I hope more multidisciplinary forums like this pop up around the country.
Of course, and thank you so much for joining us once again. And so, without further ado, Ms. Gloster, you've had an extraordinary career spanning leadership roles at the White House, at Google, and the private sector. Could you share with us your journey into AI ethics and cybersecurity? What inspired your focus into these critical areas?
Yeah. My dad is a computer scientist, and my mom is a nurse and a mathematician. And her heart for people and his focus on technology and her math focus all oriented me towards technology. But I also randomly wanted to be a lawyer. So I was like, ooh, how do I take technology and the law and marry it with my heart for people and society? And at first I thought that meant I had to be an intellectual property lawyer. I was going to protect other people's technology. And quickly realized after law school, when I got recruited to a cybersecurity company, that this is such a multidisciplinary space. Technology policy, cybersecurity, and all emerging tech areas really requires it to be interrogated and investigated and thought through a variety of different lenses. And so after working at that cybersecurity company, I went to the Department of Homeland Security in the Obama administration, and to Deloitte, and to Google, and then to the White House. And now I'm getting to do a lot of the same work, but through my own company. And the common thread through all of that is that, you know, cybersecurity is people, technology, the doctrine and processes we use to kind of keep it in line against the backdrop of an adversary. And two of those things, if that's the definition of cybersecurity, include people. So we have to be understanding of technology and context, whether that's how you use it in medicine or how you use your phone or your computer in your everyday life. That's the context I want people to have when they think about emerging capabilities and securing themselves and privacy and all those issues.
That's wonderful. And we love how you also have that like multidisciplinary mindset of how can you merge different things like law, technology, and to benefit our society. And so for a lot of us joining today, we're healthcare trainees, we're healthcare providers. Can you tell us more on why law and policy are so important for the future of AI integration in healthcare? We often see the clinical side, the administrative side, but why are law and policy so important?
Yeah, because it sets the context in which you operate. I mean, technology is increasingly underpinning everything, but in the medical space, it is a force multiplier. It's scaling your opportunity for impact. It's simplifying and synthesizing the data you collect, whether that's, the information in charts or aggregating the data that comes from some of the tests you run to provide new insights and new information. And that's a really awesome opportunity to scale up our ability to deliver care to people, and to understand their unique needs and the differences across demographics, all of that. But technology is an amplification mechanism. It can amplify the best and the worst. So as we scale up the opportunities for impact, there's also an increased risk of vulnerability. And I'm sure you all have opened the news a number of times and seen a hospital here, a school there being the subject of a cyber attack, or some kind of scaled technology attack. And that's a really important piece of your job as stewards of the data of your patients and healthcare providers, is to think about especially if you open your own practice, what tools are going to best serve me and my patients by keeping their data private, and how can I make sure that things are secure, and just be thoughtful about how you protect users. But also, if you're thinking about research or, all the other myriad of ways technology shows up in your practices, the ability to understand where you might need some technical interventions, or to identify where a technology is being used in a different way and might create new risk, is an important piece of the communication and feedback loop that needs to happen for technology to best serve us.
No, we totally agree. That makes sense. And what we're trying to understand is, okay, your everything around AI and this digital health shift is centralized around data, right? But when we think about our legal policies, a lot of the US policies and like our framework are based off historical precedents, right? Off laws that were based off decades to centuries ago. But now with new data emerging, new rules, new perspectives, new philosophies, how can policymakers stay ahead in adapting laws to the changing like tech landscape with AI?
Yeah. So traditionally, a lot of lawmakers kind of thought, oh, we'll just take things from the physical world and apply them to the digital world. And sometimes that works, but often it doesn't. And so, as folks move towards a better understanding of technology, what you're seeing is more development of frameworks that are technology agnostic and recognize the root issue that we're trying to solve. If that's privacy, if that's trustworthiness, if that's, whatever the thing is, and then building something that can adapt to a changing technological landscape. Because what you don't want is for your policymakers to have to write a new law every time there's a new capability. So every time there's a new chat GPT, you should not have to see a new law to feel like you're being protected. Part of the complication of that is that lawmakers will always be a little bit behind, and that's rightfully so that they can actually understand the technology. So it's incumbent upon us as practitioners in whatever space that we play to be a little bit thoughtful about how you can mitigate risks that are new and emerging, and be on the lookout for those opportunities to kind of bridge the gap. But the law and policy of it are really important because it creates a uniformity across organizations, and it creates accountability and transparency that best serves all of us in how we engage with a new capability, especially one like AI, where the scale of its impact is so great.
And speaking of scale and the impact, we want to talk about like something we're so impressed that you were part of on the national level. For those that don't know, they're attending. Ms. Glosser is part of the helping create the 2023 Executive Order on AI, and that represents one of the U.S. government's most comprehensive efforts to secure the development and application of AI technology. And so, can you tell us a little bit more about your experience helping craft this and how it translates to the healthcare sector?
Yeah. So one of the things that's really exciting about this administration and policy development in this Biden-Harris administration was we really honed in on how important it was to make sure that the policy was informed by the technology and the environments in which it operated and all of those things. So most of the policies and strategies that you see rolling out from the administration over the last 3.5, almost 4 years now, are informed by and in collaboration with private sector, civil society, thought leaders, all of those practitioners coming together to say, okay, what your goal is with this policy is X. Here are the challenges we're seeing. Here are the opportunities. Here's where it will fall short in my sector versus another sector. And so in healthcare in particular, looking at the AIEO, what this executive order really tried to do was lay out the groundwork, get the house in order in the federal government, hold some accountability, and give agencies the authority to ask about big foundational models and LLMs that had impact on large swaths of people, and make agencies get their house in order about how they're using AI and how they can hold organizations accountable. And some of that is supporting organizations. So there's something called a sector risk management agency for all of the 16 critical infrastructure areas. And one of those is healthcare. So HHS supports hospitals and other medical institutions in thinking about their infrastructure. And so what this was designed to do is help agencies like HHS get their infrastructure, their policies, their support in alignment to be able to help hospitals think about how does implementing AI, especially generative AI, because AI includes automation. That stuff has been happening for quite some time in security applications across a number of different technology tools. So some of this isn't new. But even in the case of generative AI, a lot of the cybersecurity mitigations that we have can help mitigate harm, but you have to apply it in those contexts. And then where there's a delta, where there's a difference, thinking about what needs to be done. And so this executive order started that work. There was a subsequent national security memorandum that thought about it in the context of national security and making sure the nation is secure. But there's a lot more work to be done, and it'll be interesting to see how that work continues in the next administration, because organizations within the government, like the AI Safety Institute under Commerce, are doing a lot more granular work on how foundation models impact sectors like this. And so we'll see how that work continues.
That's good. Yeah, and it's very interesting. You're talking about like how the work continues. That's really where we wanted to go next. And especially with your background as a AI ethicist, we'd just love to hear some of your thoughts as to like where you think the biggest ethical challenges will be as AI rollouts do continue to go forward and we start using this technology, hopefully for good. But where do you see ethical risks?
Yeah. So one, I think we have a real opportunity to get ahead of some of the ethical risks and some of the security risks. With the internet and with social media, we kind of let them happen to us, and we're thinking through mitigations on the back end. And with AI, we are at a moment where we could be a lot more proactive about how bias shows up in the building of technology, in the implementation and deployment and operation of technology, and then in how you build out the organizations that support that. There's a lot of research happening right now about foundational models and existential risk, but quite frankly, even some of the deployer focused models and how it's deployed in tools and capabilities that you already use present a number of unique harms in discrete contexts like healthcare or like in the energy sector that we need to be thoughtful about. And that requires the collaboration between sector experts and AI ethicists and security practitioners. And so what I'm most concerned about or most focused on is those intersections, the convergence of topics. I was speaking to the Nuclear Security Administration the other day and thinking about the intersection of AI and nuclear is a really interesting place to play, right? Because nuclear power plants are increasingly becoming how we power all of the technology to run AI, but that means there's an increased nuclear footprint, which can be weaponized, and there are a number of international intersections therein. And so I think the most interesting issues right now are how the safety issues like bias and all of these things play out day to day, but also these intersections of sectors that are already at increased risk or providing critical functions and the advent of AI.
Yeah, that as you start talking about nuclear energy and that kind of thing, that definitely a risk there.
Yeah.
So for us as medical trainees, one thing you were talking about in there was the need for collaboration, the need for experts in the field. And at this time, we are not yet those experts, but we are training to become those experts. And I would love to hear you talked about the importance of collaboration there. And what would you say to young residents or medical students or just people earlier on in their career? If we are interested in this, how can we get involved with that collaborative work?
Yeah, so that's a great point. First of all, don't think that you're too early in your career to weigh in. You're probably more technologically savvy than most of the attendings you'll be working with, right? And the technology that's to come will be built around your needs as a practitioner. And so vocalizing those things, your perspective, and as a fresh pair of eyes as you learn the new technology or technology that's new to you that's being implemented to help you do your jobs, you have a fresh perspective on the opportunity for risk and areas of focus and things like that. Most of the agencies at the federal level and even at the state level open themselves up to comment or have working groups that bring in practitioners to have conversations. So across the components under HHS, Health and Human Services, there are a number of working groups where you can get involved and share your perspective. Same thing for the National Institute of Standards and Technology under Commerce, NIST. There are a number of working groups that focus on these topics at the intersection of different sectors and a technology, or just a technology writ large, and you can weigh in. But more discreet and more concretely, every day, you should be talking to the administrators of the hospitals that you're at, the medical institutions that you're at, and asking questions about security, about how they're using AI technologies, how that has been incorporated into their resilience plans, how they're thinking about that vis-a-vis user or patient data and your data, quite frankly, and then what opportunities there are to use that for research and other things, like not the data of your patients, but use the implementation of technology to advance different ends and figure out how best technology can serve your practice. So I would say you could think about it twofold. If you really want to get involved on a national or even an international level, there are a number of ways to lend your expertise, and it's never too early because you've got insight that other people don't have. But at the institutions where you are working, you should be vocal about how technology is showing up in the lives of your patients and in your practice, and what that can mean and what it should mean, and hold them accountable for being good stewards of your data and your patients' data.
Yes, yeah, it's something we talk about frequently, about how the imposter syndrome that we all face of, well, maybe I'll get involved in the future, but of course now I'm not ready to do that. But I think you're definitely right that we need to get involved now, and people can get involved early and give more than they think they might be able to. When we talk about our home institutions, and just in general implementing AI powered tools, a lot of times there's a lot of fear, be it about job displacement, reduced patient autonomy, problems in patient care, which are all obviously very large issues. But we also know that there are large benefits. So what would you recommend if we're having those conversations about AI's potential for helping better healthcare? How would you talk with someone who's a little bit more skeptical about that and be like an advocate for ethical usage of proper tools?
Yeah. So, well, first of all, I would make sure that people know that AI is a tool. It's a tool to leverage data at scale, but all it can do is, it's only as strong as the data it was trained on and the algorithm that it is using to comb through that data and parrot back a response. And so while it can be an input, it should not be a decision maker at any point in somebody's care path, right? Like, if you are seeing technology show up and make a decision about how someone should receive care or making the diagnosis, you should be thinking about, how do we integrate a human to gut check that and to use this data to actually make the decision? Because we are not at a place yet, nor do I think we should ever be at a place where technology makes a decision in isolation. There's so much context and intellect that people have that should be married with technology to make your job a little bit easier, but it shouldn't replace human intervention. Now, it might remove some jobs, some of the more rote tasks and things like that, or reduce the number of people that you need. But it also will create a number of jobs in a number of different areas. And so one of the things that was in that AI executive order, and you'll see even in initiatives around the world, is as AI is implemented, we need to be thinking about, how are we training people to take on those new roles and to step into the new jobs of the future? How do you upskill and right skill and adapt to the changing technological environment? Because AI is not, especially if implemented correctly, is not going to take away so many jobs that there's nothing for anyone to do. There just might be different things for people to do. And so we should be able to think about our labor markets in a way that allow us to transition people from where they are to where the jobs are. And then also, if we keep people in the loop, as I described earlier, that creates space for them to remain in these in the areas of work where they're in, but maybe with enhanced responsibilities. And it also means that you're probably more excited about the work you're doing, because if AI is taking off the menial, like, repeat tasks that you hate, that means you've got more room for patient care to actually think about bigger issues, and not some of the smaller tasks that most people would love to offload off their plate.
We love how you talk about AI as more of like an augmentative tool as opposed to something that's replacing it. We feel that if that narrative is being pushed forward, people can not only enjoy the fruits of AI, but also be constructive on how they address potential shortcomings. And so when you talk about like one of the shortcomings of training data, a lot of the data that people are putting into these large language models, a lot of times they're stemmed on like health inequities, and there may be
Mhm.
algorithmic bias, and that can also affect healthcare outcomes. And so, can you tell us more about these biases with training data in healthcare and how we can work together, maybe with researchers and academics, to like address them so we can have safe AI?
Yeah, I mean, that's part of it being a tool, not a solution, right? If the data is trained on one demographic of person, then you're right. The output that it provides is not going to be attuned to every community that you might see and treat in your practice. And so, yes, partnering with researchers to make sure there's better training data, identifying where there are gaps in the data that train a model that you do use, and leveraging that to understand how to use AI as a tool. So, if you know that a tool was developed on US centric data, but you are now doing Doctors Without Borders, then you have to know that whatever that tool is giving you is a place to start, but is not a definitive answer, because the data that it was trained on is from a population with a different set of impeding factors that influence them, from the environment to socioeconomic resources to education and beyond. And then not to mention the racial demographics and how that plays in, and gender and all of those things. And so, to your point about how important it is to think of it as a tool of augmentation, when Wikipedia first came out, people started like freaking out because, oh my gosh, this isn't a real encyclopedia. It wasn't done in the traditional ways. People can't use it. But when we in schools decided to change the framing and make sure people know that, okay, you can use Wikipedia, but it is a starting place, right? This is crowdsourced information, and it can be a great lead generation, but it should not be your sole source for justifying a perspective or writing a report or whatever you're doing. That's what we need to do with AI, and really change the framing, because those underlying biases in the data are inevitable at this point, because the data we have collected historically around the world, but particularly in the US, do not include all of the demographics, particularly in a world with such changing demographics. The country is made up very differently than it was when a lot of the data that is the foundation of modern medicine was collected. And there's lots of research initiatives going on, and a lot of money being poured into it at a federal level and at a state level, but there's still a lot of work to be done. So as practitioners, you also recognizing that any tool that you're handed has an inherent bias, because there has never been this treasure trove of data that has everybody's information and is perfectly attuned to the demographics. So you'll have to think about how you leverage that as a tool and not as a solution.
It just shows us that whichever institution we work at, it's so important they have a robust data governance structure. And also, when you talk about data like credibility, that's one thing we loved about the executive order. When we were looking at it, there's with all the big tech companies, there's that checks and balance system, making sure that the data is safe and it's equitable for those that are using it. And so we'd completely agree with that. One thing that's a problem with data is the black box method, right? Like, for example, imagine you're putting something into ChatGPT and then you don't know what it's doing, but then it just gives you an output, right? And so that's one thing that's a really big problem in healthcare. Like the trust in AI depends on dependency, but there's challenges like HIPAA compliance or AI releasing too much patient health information. And so how do you think like on a systems level or on a local level we can improve the transparency aspect?
So this is why it becomes increasingly important for actual practitioners to develop expertise in AI, and then help influence how tools evolve, and then how the policy landscape evolves. Because there is going to be a discernible line between too much patient information and a sufficient amount of aggregation that it can provide an indication that's useful for a practitioner. But me, as a person who does not comb through medical data on a daily basis and doesn't know what pieces of data might indicate a broader set of issues, or just straight up point me to a person or a demographic in a way that's harmful, needs your expertise so that we can layer in that kind of directly relevant, sector specific patient care lens to be able to find that discernible line. And so when you think about what are the frameworks that we need to build and sustain for AI, a lot of what you'll see me and a bunch of other policy-oriented folks talking about is the need for them to happen in sectors, right? Because the discernible line of what's valuable, what's ethical, what's aggregated enough or versus not enough is going to be very different in healthcare than it is in energy, than it is in education, than it is in another space. And so if HHS and the is already focused on HIPAA compliance and a number of other compliance mechanisms to be able to drive patient privacy and promote patient care, that's also the place where we should be integrating AI expertise so that we can augment those existing frameworks to be able to be attuned to these specific needs. And so one of the things that you saw in the AIEO, and I really hope continues, is this investment in getting AI expertise in agencies across the government to be able to bring that lens to these existing frameworks and these existing institutions that are attuned to sectors. Because that line is unclear now, but the hope is that in the future, through research and through this multidisciplinary approach of bringing people together, that we will be able to find that line.
That's so beautiful how you're bringing in different sectors together, and that's being institutionally like integrated from like a national level. I think that helps with like really building the shift like a little bit faster. One thing that people may come across is, okay, if there's a lot of different sectors involved, the private, the public, or like whenever there may be a harmful outcome, assigning accountability can be pretty complex. And so what are your thoughts? Who should be the ones that are bearing responsibility? Should it be the developers, the providers, the patients, the institutions? What are your thought processes on that?
Yeah, I mean, this is a really, really hard question, and neither is it uniform. We're also thinking about this in like a software context. If there's an open source developer who creates something for free and it ends up in a bunch of software that you use across a bunch of paid services, who's responsible? That developer that dedicated their time and talent to write this thing for free, or this big software producer that created something but relied on that piece of software? That same model happens in AI as well, right? Where people create things and other people build on top of them, so you're not recreating the wheel. And that creates a real complexity because there's not one manufacturer or one creator to say, well, you created this and you should be able to guarantee that it is fit for purpose in these ways and for this amount of time. And so we're really grappling with what that looks like. And there's no discernible answer because so much work has already happened, and companies are asking for things like a grandfathering in clause that allows you to be forgiven if something happens for the things that you created before. But also, there are a list of cybersecurity best practices. There are a list of ethical best practices. Even if you implement all of the things that we know today, an attack could still be waged against you, or you could still create a harm that was unintended. And so do we punish companies for mitigating for all the harms that they knew were possible, but not being able to imagine a world where this new harm popped up? It's hard to say yes to that. And so even if you decide not to do that, so you just punish them for harms that we already knew about, and you have to incorporate certain behaviors, there's still a delta between what happens and what we anticipated. And so then who is on the hook for that? And so there's some real complexity to figuring out who is accountable when harm arises. We need to keep working on it. We need to have some kind of accountability structure, even if there are gaps. And I lean towards this. The manufacturer needs to be on the hook and leave individual developers, especially if they're not a part of some bigger institution, out of it, because they should be responsible for double checking the code and the things that they take from the open source market. But there will still be a delta between those things that they know that they can mitigate for and some new harm. And so how does a government, whether a state, local, be able to support whoever is experiencing that harm?
And that's the trivial like $1 million question right now. Who is accountable? Every single person we speak to says, different things. And It's really interesting to get your perspective on it, working from a national policy level. Some people have even said all the stakeholders that are involved, the developers, the providers, the institutions, everyone should have their should be liable at the end for whatever outcome comes about. So it's very interesting.
I mean, that's a hard one to implement. Everybody's responsible,
Yeah.
and nobody's responsible. How much?
Yeah.
What percentage is someone paying out like that? That's an interesting concept.
Well, speaking of paying out, one of the things we wanted to talk to you about was economic impacts of AI. And you had mentioned, some of these tools might come from an open source developer, but then some of them will be these really expensive solutions that need to be trained on very specific data, and you have to pay NVIDIA $1 billion to be able to create your model or whatever it is. And we wanted to get your thoughts on the ethics of that. We don't want to hold anything back if we are able to, in a very financially resourced setting, use these tools. But there also are resource imbalances, and we don't want care to suffer in other areas where they're not able to train their own models or anything like that. So can you speak to the ethics of that question?
Yeah, I actually just released a report that touches on this in some part about how do we make sure that AI innovation is spread globally, because a lot of the places where there are no resources to create AI innovations in health sector or otherwise are around the world. I mean, there are still some domestic too, and some rural communities, et cetera, but the access, there's an opportunity for access that can be federally funded or state funded and kind of distribute the resources in a way. But how do we make sure that happens globally? And what we've seen is that there are a number of companies and a number of organizations that are trying to do some kind of benefit sharing. How do we offer compute credits or offer licenses to a model that an organization or a country can layer in their data? But how that data is then leveraged by the organization can sometimes be imbalanced, and there's some real difficulties with that. But one of the things that goes back to kind of what I mentioned at the beginning about making sure that everybody is kind of sharing in the benefits of AI innovation and learning the lessons of the internet and social media is that when you leave countries and communities behind, you uncover new harms and new opportunities that you missed out on. And so for us to truly capitalize on the benefits of AI and to mitigate the risks, you have to raise the collective tide so that our security and our prosperity are at the highest levels possible. Because if one country is dabbling in AI at any level, whether they're a developer or a deployer, and another country has a robust infrastructure and all the security and privacy you could ever want, the harms that are waged against that smaller nation, they know no borders. The internet knows no borders. And so those harms can spread and have cascading impacts on everyone. And so the best way for us to do this work is to find ways to share the resourcing and to support other communities, countries, whoever in their endeavors to get better integrated into these systems that we're building and to create their own organic, attuned to the community AI innovations.
Yeah, that makes a lot of sense. It's a rather elegant solution to a pretty complex problem, but it would be great if a rising tide raises all boats, and this truly does better healthcare provision all around the world. Kind of playing on your expertise and your experience at a national policy level, we haven't really been able to talk to too many experts who have vision into global AI differences. And so we know that the U.S. has led efforts at the UN in order to establish some AI safety norms. And how would you say that the U.S. healthcare's approach to AI adoption and AI ethics has compared to that of other advanced nations?
I mean, the US is often at the forefront and sharing insights, resources, and learnings with partners and allies of all sizes and whether they're well resourced or not. And so that continues to happen in forums that are dedicated to healthcare and in broader forums. They're bringing those learnings. At a private sector level, as well as at a government level, there's also funding that's going into these efforts and resource sharing like the compute and other things that I talked about earlier. Those efforts are aligned a great deal to like the Sustainable Development Goals and making sure that countries can sustain themselves in the years to come and in the changing climate environment, and through a number of healthcare issues that are increasingly turning into global pandemics and global issues, especially with the migration of people and how much we all travel. And so healthcare is a unique space and a really important one because there is a recognition there of how interconnected we are and how inextricably linked our healthcare is. And there's already a lot of investment in supporting other nations in achieving the desired healthcare outcomes. And so the hope is that AI will be a natural outgrowth of that, and that they will include and incorporate those innovations to help scale that impact in a way that allows nations to keep pace. And what we've seen so far is the sharing of that information has happened, especially across research institutions, like universities that have large hospital systems. They are doing a lot of sharing with counterparts around the world. And vice versa, right? Like there's a lot of innovation happening in other regions, in EU and UK, all over the world, in Singapore and Japan. And so they're sharing their learnings as well with companies and hospitals in the US.
Yeah, we see a lot of forward-thinking decisions also being made in Europe, and it's nice to see that there's still like healthy conversation going on at that systems international level, because a lot of those things we can adopt too as a country. So when we talk, that's from the country level, but now when we look within the United States, have you seen differences in the way different states are adopting AI and like the practices on the state level? Anything you've noticed about the ethics of that?
Oh, so many things. I mean, at the state level, they're all different, right? Some want to be forward leaning on regulation, almost similar to the dynamic between the US and the EU, where they're like, we're going to get some guardrails on this. And particularly in the absence of national level regulation, there are some states like California and Colorado that have been very forward leaning and articulating boundaries. There are some sectors in particular where there's a lot of work to move things forward. Even if you can't get a holistic AI regulation, how do we get AI regulation around healthcare, or California passed ones protecting like actors and entertainers, right? And finding those tailored solutions where you can't find a holistic one. The resourcing of different states and different locales within states really matters. So what you're seeing is a number of health systems in larger cities or more well-resourced states being able to lean in on advancement, and some of the smaller hospitals and medical facilities in rural America and in smaller communities lagging behind a little bit. And so there are some efforts to try to spread out that knowledge sharing, but also access to the tools that can help scale impact. But there's a lot of challenges in the healthcare space in general, with hospitals closing and people having to travel a long way for care. And those things only are exacerbated in the positive or in the negative with technology. If we're not thoughtful about it, it could mean that the divide is greater. But if we leverage that to close some of those gaps, and it could mean that even if you had to travel for care, when you got there, the care was so comprehensive and helpful that it mitigated some of the negative impacts of having to travel for that care.
Yeah, definitely. Like seeing how the pros outweigh the cons when we're using the AI. And we want to actually lateral to a topic that is surfacing a little bit more recently. A lot of the next generation, when we're talking about AI, the next generation of healthcare providers are seemingly becoming more reliant on AI, whether it's things like ChatGPT, open evidence, and then like the current generation of providers, while they're still like new to it, they're also starting to use it to augment clinical intuition. And so, how do we ensure that AI amplifies expertise without replacing human judgment in a way that compromises patient care for generations forward?
Yeah, I think it's twofold. One is that general recognition that it is a tool, not a
Mm.
solution, and teaching that to everyone at all levels and all stages. But then also putting in the policies and procedures and the guardrails to make sure that that happens, whether that's at an organizational level or a state and federal or international level, really recognizing there is no point at which AI, at least no point in the near future, that AI can, surpass human intelligence to be able to analyze the data, analyze the environment, and be able to spit something out. It is subject to the data it has been fed. And so it makes it a really great tool to synthesize treasure troves of data. We've got all of these data stores of really helpful information, but that will never surpass you recognizing that this person has some unique marker that then indicates something else, or that the day of the week means that they whatever. I mean, it doesn't really matter, but there's so many things that we pull into our decision making every day that you don't even think about, and you can't really qualify or quantify in most cases. Your intuition, your, having experienced things and seen these cases before, or knowing that one day in class they talked about this really rare disease that this might just be, and maybe you should think about whether or not it's that. And so that recognition will be really important moving forward, especially in healthcare, but in a number of fields where the human intuition, human knowledge is integral to achieving the desired end, whether that's patient care or whatever.
Yeah, we learned about it in actually in our master's course in biomedical informatics. It's this theory that AI and humans are their own separate entity, but AI plus humans can be greater than just independent humans or independent AI. And so I agree. And that's something that should be incorporated more through medical education, medical training. And as we wrap it up before we open it up to the audience, what are your thoughts? Do you have thoughts on how medical training or training institutions, what specific things they should integrate um, to help providers be equipped?
Yeah. So I think at a base level for everyone, there are a set of cyber skills that they should learn.
Okay.
Right now, education is based on reading, writing, arithmetic, and there are a set of cyber skills that every person should understand. That's digital literacy, knowing how to use it, turn it on and off. Computational literacy, understanding the impacts of the decisions you make, whether that's on your privacy, your security, your safety, on the society that surrounds you, the organization. And then digital resilience, the ability to adapt to changing environment. If everybody learned that and then carried that forward into their careers, we would all be much better for it, because you'd have the context on how technology can change the circumstances of the field that you operate in. And then beyond that, in healthcare in particular, I really think an understanding of security and privacy and how technology works in context, and just the fact that technology is a tool for amplification, and the responsibility and kind of adding to that moral code that practitioners already have, by leveraging an understanding of how technology can augment that in the best and worst ways, is where the curriculum should evolve to meet the moment. Technology underpins everything, whether it's the administration of a hospital or how you do your job as a practitioner. And so recognizing the limitations of that and the opportunities in it, both sides of that sword, that coin, are important. But right now, most of the time, you're only being taught about the positives, if that, and not the negatives, so that you can proactively mitigate them.
Well, we're almost at the end of our time. Thank you so much. I wish we could keep this conversation going longer, but I know you're very busy. I guess as a final question before we open up anything from the chat, we'd just love to hear, if we're having this conversation 10, 15 years from now, what do you think this meeting looks like? What problems have we solved by then, and what are we still working on?
I hope it's not exactly the same, but that is the fear. I hope that some of that integrating cyber skills across disciplines and at the K through 12 level starts to happen, so that people are walking into these conversations more cognizant. Right now, I feel like in large part, especially in the US, we've got that digital literacy piece down pat. Everybody knows how to turn the tech on and off, right? But we're not being intentional about how we engage with it. And I want people to be making informed, risk-based decisions. In your physical safety, you make a choice. Karate, so you're going to walk down the alley. I don't, so I'm walking the long way around with the lighted path. And that's okay. Both choices are well informed and safe for each of us, because we know our personal circumstances and the environment around us. People don't make the same choices in their digital lives. They just jump headfirst into the alley. They don't think about whether they know karate or whether they have any kind of safety mitigations. I want people to be more thoughtful about that. And that's in your day-to-day life or in your professional life.
Love that answer. I think I'm going to steal that karate analogy next time my mom falls for a cyber attack or something like
Oh
that.
my gosh, please do. Poor mom.
Oh, that was fantastic. We'll go ahead and give an opportunity to anyone attending if you guys would like to ask Ms. Gloster some questions. We'll also go ahead and check the forms. We got this one question. So, with programs like 23andMe, there's concerns about whether genetic data could influence health insurance or dictate care. What processes are or should be in place for healthcare privacy in these type of contexts?
Yeah, there aren't enough right now because I believe 23andMe is the one that had this big research contract where they sold off all of your data. So I hope you did not use
Yeah.
23andMe. But there definitely should be some parameters around that. There is a reason that insurance is developed with the the ability to look across a large swath of aggregated data, but not pinpoint your specific healthcare needs and all of that, because then there will become this unfair dynamic on how you're charged, and leveraging your information for research without you being compensated for it is a real problem. I don't know if you've ever heard of the story of Henrietta Lacks, but her DNA is the foundation for modern medicine, and her family got no compensation for that. And you own your data. You should be able to have some say in how it's used. And then if you'd like to, be able to monetize off of it. And every day we trade our data in for the use of services, and we make that knowing choice. But to have it taken from you at a scale that you didn't intend for, right? To have your whole DNA history, your family lineage history taken and used for an organization to make money 6 different ways between research and feeding it to different insurance companies is unfair, and you should not be subject to that. So we definitely need to figure a regulatory requirement that limits the ability to sell that data to third parties.
Yeah, that makes a lot of sense. Seems like a very good area for the law to step in.
Mm-hmm.
Speaking of a very similar question here of a possible area for the law to step in, we've seen some amazing things with AI, with the ability to make funny deep fakes, but they become a lot less funny when they're in the area of healthcare. And we've
Mm-hmm.
seen examples of possible telehealth expansion, and then how that could be a problem if a provider's voice or image is faked, and then it's spreading misinformation or some sort of harm to patients. Do you have any thoughts on what we could do about that and the ethics surrounding potential deepfakes invading into telehealth?
Yeah, I mean, so I don't think there needs to be something. Well, actually, there probably does need to be something specifically tailored to being able to perpetuate such an attack, because the outcomes and the potential loss of human life are so great that that there should be specific requirements and liability implemented for somebody who perpetuates successfully, or actually not successfully, an attack like that. That said, though, the requirements that are being built, the regulations that are being built to stop misinformation and disinformation in general, and then these shallow fakes and deep fakes leveraging AI, should account for that. The mitigations that are happening both at a technical level and a policy level should be able to help slow that work. But quite frankly, as we talked about earlier, the malicious actors move a lot faster than the regulators. Our biggest hope is technological interventions, and there are a lot of companies that recognize just how harmful that is and are trying to figure out ways to make sure that images and videos are authenticated, and that patients or users of whatever kind are able to kind of discern when something is authentic or not. One of the things I like to tell people, a friend of mine calls it politely paranoid, but think about sensitive areas of your life and be pretty discerning about how you let them engage with you. So, for example, whether it's healthcare or it's your bank, you should be validating incoming information at least 2 separate ways before you reveal anything personal or private. So, you get an email from Wells Fargo saying, hey, your account has been hacked, you should be calling Wells Fargo or using your app without clicking the link in that email to validate that. Same thing if it's a telehealth visit. You should be, if you just randomly get a message from your doctor unsolicited telling you you have X, Y, and Z, or that you've been, pulled into whatever, you should validate that by calling the doctor's office directly or by checking your patient portal. There are ways for you to kind of validate this incoming information. And so I charge people to be a bit discerning and to validate at least 2 different ways the information coming at you. And one of those ways should not be you clicking on some random link that somebody sent you.
Now, whenever we have the Duo 2-factor authentication, just take it seriously. Take it seriously and appreciate it.
Yes, please do. Take the extra few seconds to do it.
No, that's amazing. But Ms. Gloster, thank you so much. Like, on behalf of everyone here today, we want to express our deepest gratitude to you for sharing your time, insights, and expertise with us. Your journey and work at the intersection of law, technology, and ethics, they've not only shed lights on how complex AI is from multiple levels, but it's inspiring us to approach these challenges with responsibility and vision. Your leadership reminds us of the importance of collaboration and equity as we shape the future of AI in healthcare and beyond. And so thank you for joining us today and empowering us to think critically and act boldly in our own careers.